A cohort study done by Mabarkey in 2017 found that the Roux-en-Y gastric bypass response was within the expected range of about 67% of excess weight loss at the end of the first year. While obesity continues to be an issue across America, bariatric surgery has proven to be an effective treatment option in cases of severe obesity. Today, I would like to take this opportunity to talk about bariatric surgery as a treatment in cases of severe obesity, the types of bariatric surgery, and the results, risks, and benefits of bariatric surgery. Bariatric surgery has come to be an effective tool in treating severe obesity. Dr. Cynthia Ogden of the CDC states that the prevalence of obesity was 36.5% among U.S. adults during 2011 to 2014, and that obesity among women was at 38.3%, and for men it was 34.3% during that same time frame. Obesity in 1999 and 2000 was at 30.5% and rose to 37.7% by 2013 and 2014. Evidence has come to show that bariatric surgery has a lower risk than that of premature death due to severe obesity. According to the United States Department of Health Services, individuals with morbid obesity or a BMI of over 30 have a 50 to 100% risk of premature death compared to individuals of a healthy weight. While Mr. Weiner points out that bariatric surgery has been shown to be the most effective and durable treatment in obesity. This is evident in the report done by Mr. Wynn, stating that laparoscopic bariatric operations have increased from 20.1% in 2003 to 90.2% in 2008. With over a 70% increase, this leads me to the types of bariatric surgeries available. There are 3 different types of bariatric surgeries for patients to consider. The most common is the laparoscopic gastric bypass, also known as the Roux-en-Y. This is done by dividing the stomach into 2 sections and bypassing 3 feet of the small intestines. The small section, also known as the pouch, is the size of a walnut and it aids in the reduction of calorie absorption. The larger remaining section is then reattached to the intestines further down, and this is so that the enzymes in the stomach can still aid in the digestion process. The second option is the sleeve gastrectomy, also known as the sleeve. The stomach is divided vertically in half and stapled. This makes it look like a banana or a sleeve. This reduces the size of the stomach between 80 and 85%, and the remaining section is removed from the body completely. The final option is the laparoscopic adjustable gastric band, also known as the lap band. This is a silicone band that is placed on the top part of the stomach, and there's a port connected from the stomach to the abdominal wall of your stomach. The band can then be filled with saline to adjust how tight or loose the band is to reduce the amount of food intake. When considering one of these bariatric surgery options, you must also consider the results, risks, and benefits. Each of these individual people will have varied results, risks, and benefits. The results of bariatric surgery, weight loss in the first year or 2 is the best. Dr. Whitgrove states patients may lose as much as 60% of excess weight in the first 6 months after surgery, and 77% of excess weight as early as 12 months after surgery. Patients maintain about 50% of their weight loss after 5 years, according to Dr. Adams. While there are risks with any surgery, risks vary for each type of bariatric surgery. The Roux-en-Y can cause the inability to absorb the amount of nutrients that your body needs through food and developing adverse reactions to medications. The sleeve can cause stomach ulcers and scarring on the stomach that can cause leakage. The lap band can slip out of place and there could be an infection in the port area. Like results and risks, the benefits of bariatric surgery also differ from patient to patient. A study done by the New England Journal of Medicine found that bariatric surgery increases the patient's lifespan. Gastric bypass patients may improve life expectancy by up to 89%. Patients may also reduce the risk of premature death by 30 to 40%. Bariatric surgery helps improve and resolve many obesity-related medical conditions. According to Dr. Buchwald, type 2 diabetes is improved or resolved by 86%, hypertension by 78.5%, and sleep apnea by 85.7%. Additional conditions that can be improved are GERD, hypertension, high blood pressure, chronic pain, and joint issues, along with other physical and medical ailments. With obesity being such an important and startling issue, bariatric surgery is an option for treatment of individuals suffering from severe obesity. There are many options pertaining to the types of bariatric surgery, and each patient is able to choose the appropriate surgery that's best for them and their conditions. They can take into account the type of results that they hope to achieve, understand the risks, and reap the benefits of bariatric surgery. For people to understand the risks of obesity and the abundance of rewards that bariatric surgery provides, this allows individuals to enjoy a renewed and healthier lifestyle. Thank you.